And bonjour. This is Bruno LARVOL from LARVOL. And this is the third episode of our new podcast called LARVOL CLIN, Build in Public. So we are sharing with all of you the building of what is our most exciting product, the Wikipedia of cancer data. And I'm here today with Mike Bolster, who, in addition to being our head of sales and strategy, has been also involved in one of the very important features of LARVOL CLIN, which is a key opinion leader, or more precisely, digital opinion leader feature called Top Voice. And so I invited him today to discuss that feature. So, Mike, welcome to the podcast.
Thanks, Bruno. Pleasure to join.
Just before we start talking about Top Voice, Top KOL Voice in oncology, and Mike is going to walk you through how we build that feature, and it includes a peer survey, by the way, but other aspects as well. Just before that, I want to explain what CLIN is. Think about CLIN as a Wikipedia of clinical trial data. Every single publicly disclosed information about any clinical data, any clinical trials in cancer is in CLIN. CLIN, by the way, is available for free for non-commercial use. So you can go to LARVOL CLIN and access it and play with it right now. Right? And the other thing I would say is that one element of CLIN that makes it very unique that we're going to focus on today is that we have a panel of up to 5,000 oncologists on X, on Twitter. They're all verified oncologists. They all tweet about oncology data. And one of the things we did is that we are curating all of their commentary, all of their reaction. And this is a big element of CLIN because it adds a lot of color to every new data that comes from conferences or publications in the cancer field. So I'm going to pass the baton to Mike, and he's going to explain what the Top Voice is and any additional color on the way we treat influencers on CLIN.
Thanks, Bruno. So yeah, it's exciting that we've been able to consolidate this data this year. We've been engaging with DOLs for a few years now. You've been talking to a lot of them at conferences and getting to know them better, and it's fun to be able to get their insights integrated into our CLIN platform. So we've run 5 surveys at this point, where we plan to run them in all major cancer areas. This is a view in CLIN for our lung DOLs, and you can see that we have the top voices tagged here. So essentially our process behind this to identify these top voices is to let their peers select them. And so we've engaged directly with these DOLs through X or through email, and asked them to provide their insights in the survey. We ensure the data is accurate, and then we publish those results for those top 10 to 20 voices in each cancer area. At this point, we're nearing 100 DOLs that are considered the top voices, and looking to expand that, later on, as well as to get continual insights too, and see how this data changes year over year. So let me move around a little bit in the platform. So you can see here, these are the top voices we have for lung, which is pretty helpful for being able to determine, who the top voices are. It's a little bit more helpful, I think, especially where, our customers are seeing the value from it is when we look at the trial view, that you're able to see this information as well. This was one trial, the Natalie trial, that I pulled up this morning. And, I think it's pretty interesting that, we do collect the sentiment on these tweets as well. And you can see that there's actually quite a lot of negative activity in relationship to this trial. But one of the interesting things I saw is that among the top voices,
Mike, let me interrupt you. We're still at the page that shows all of the DOLs. We haven't. Yeah, here we are.
There we are. Yeah, thank you. So yeah, this is the insights from the Natalie trial. I'll scroll back up to the top so you get the view. This is right from the trial view in CLIN. And like I said, one of the interesting insights I had just from a quick glance at looking at this is even though there's so much negative activity, it really is only coming from, I want to say really 3 of our influencers for the most part, is where the most volume is. We could look and click through to see some of that if we wanted to. But it's interesting to me that some of our top voices, like Dr. Tarantino here, also had some sentiment that was ranked as practice impacting. So I think our customers are able to take those insights for what they are and make their own conclusions from them. But I think it's great that we're getting positive feedback that this information is helpful and not able to be consolidated elsewhere.
To brag a little bit, we are the only vendor with that product. No other vendors. Some other vendors are monitoring KOLs on X, of course, but no other vendors has been able to build a quantitative analytics, including sentiment, to cover the entirety of oncology and the entirety of DOL. We would have heard that by now when we present this product. So I'm very proud of what you and everybody in the team has done. Now, the way we did it is that we're covering the entirety of cancer, and we split it in 8 areas. Let's see if I test my memory. You tell me if I got it right? So these are not tumor type. They're a little bit broader. They're specialty. They're broad area that when people follow cancer, they follow lung, they follow breast, they follow GI, they follow GU, they follow IMHONC. I'm getting closer. They follow GYN, they follow head and neck, and then we have a broader category which is other. Did I get them or did I miss one?
I'll see. I think you got them all.
Yes.
I think if I followed around correctly.
Yes. And so our whole area of monitoring activity is organized in these 8 areas. There's a bit of arbitrary in it, but by and large, we think that's the way the industry and even the academic world is segmenting oncology into these areas.
Yeah, definitely. I think it's also maybe worth sharing, how this looks in the conference side of things as well. I'm going to switch to a different tab, and this is from ESMO, for example. So, like I said, exciting that this is finally live for everyone to be able to utilize as well. But you can see, from the top voices at ESMO, and I'm sure we've discussed probably some of the sentiment ratings in the past too, but being able to jump right to seeing the top voices. And knowing that their peers have selected them for this, and I think it does help you kind of skip right through. Maybe I don't want to call it the noise, but right to maybe some of the people that you're already following or seeing who else has that same opinion on who their top voices are in the area is interesting.
There are 2 of them that we are always very fond of. We know them very well, actually. There are 2 opinion leaders that are always critical, right? Or maybe they say out loud what other people don't say. They have less of a filter, and you can see who they are on this on this graph. The 2 longest red commentaries, and although one of them has a proportion of all of his comments is even more critical than the other. So I find it fascinating to profile each of these. And you can see Onk Brother is never saying anything negative, according right, and is one that calls out the practice changing the most. Dr. Amol is more critical in general, or more maybe has less of a filter, I would say, in some ways. Onk Brother is always. I mean, it's remarkable. They never said anything clearly negative, right?
Well, this is just for ESMO at least. So I mean, we could look at it
ESMO.
outside of ESMO too. But yeah,
But
for
I
ESMO,
suspect that's their style, right?
Yeah, probably.
Probably. It is probably. And so I find it fascinating to understand the profile of these DOLs, who are, of course, have different communication. Look at the long tail, because of course that's top, but we also have the long tail at the bottom, if we click on show more, okay, of others. Okay. Now, the other thing we have is we call it the Mike Thompson chart. It's two analytics to the right if you click on the arrows. And it's a matrix. It's a heat map of sort, essentially. And Dr. Mike Thompson was a very active, very respected IMHONC, currently working for Tempus. He is famously maintaining a heat map of that type, a matrix of that type. And with his permission and a little bit of his help or advice, we built online a similar matrix. And here you can see the main commentator oncologist and the main disclosures at ESMO. And then we have on that matrix the tonality, the sentiment of the commentaries. You can click on any of these cells and see what was said by that DOL, that digital opinion leader, about that particular disclosure.
Yeah, and I think it's still interesting to me. We were just having this discussion with a customer. I think it was yesterday, about how all of this still really is in X. About how sometimes it feels like maybe the discussion might be in LinkedIn, but it's not. It usually starts in X and ends in X to a certain extent. So I think it'll be interesting to see if things change over a few years. But it's been pretty steady, and this seems to be, the place to track this activity. I don't think it's going to change, but I guess maybe others might disagree.
So one of the things that we do at least once a year, if not once a quarter, but certainly once a year, is that we are giving, based on our very disciplined methodology, we are giving our assessment based on the peers survey of the top voices. Not in oncology in general, because I would argue, Mike, there's not such a thing as oncology. It doesn't exist. Nobody is a specialist in oncology. They specialists in GI, in GU, in lung, in head and neck, in HemHonc, and even sometime in a more narrow part of these specialties, certainly in the North American and European context. In other countries, they're even broader. They're more oncologists in general. So we see one of our contribution to provide the more methodologically serious way of measuring the impact of the top oncologist visible on social media in each of these 8 specialty areas. And so please, if you're listening, keep an eye on these. Also comment, suggest, ask questions. Feel free to jump in either now. We're going to close the call, of course, in a couple of minutes, but there's still time for questions for Mike or for me. And you can leave questions even asynchronously, and we'll do our best to answer it later on. So any final words from you, Mike, as we're about to close the call?
No, I think I said everything I felt like I needed to on this. It was great to connect on it.
All right. Thank you very much for joining, and thank you for leading the Top Voice effort with Yamini and other people involved as well in that effort in our team. Thank you. And we'll see you next week. The topic hasn't been decided yet, but we'll post it ahead for the next episode of LARVOL CLIN, Building in Public, the Wikipedia of cancer data.